So the questions from your side is in terms of health screening. We adopted the approach. I think every one of you know that our approach is basically targeted approach in terms of the location, in terms of the high-risk group. And we have been doing this from day one in terms of our containment. So we do not screen everyone, but we just look into the containment, and then we go after those PUI, and we go after those close contact. And we do know that the close contact is about 30%. If you have a close contact with a positive patient, the chances of you to get positive is about 30%. So that is the data that we have. So our approach from early containment and even late containment, we go as an active case detection. On the PUI, if you have symptoms, PUI plus the close contact. And with this targeted approach in MCO 1 and 2, we have shown the result today. So now, if we were to do mass screening for 32 million population, for example, the whole country. So if we start whole country, whether it is feasible or not. So whether it's necessary or not. So this is a thing we still maintain in the Ministry of Health, targeted approach to the location and to the high-risk group. And if you identify the location, for example, then we'll go in and EMCO in that area. And in EMCO, we screen everyone. So it's very targeted approach that how we do, so that we can have a high impact, and a good outcome in a short period of time, so that we can focus our resources into the targeted group. So that's our approach now. And returnees, yes, in terms of returnees, we are also using the targeted approach. Otherwise, our targeted approach have shown results. Initially, when we were questioned whether to screen everyone, and I was also informed in Korea, they do not screen everyone. Only targeted group that actually, in a high-risk group, they will do it. So we will continue to do that. Even then, in terms of the tests available, we have two tests that antigen test or antibody test. Our gold standard is RT-PCR, and our capacity is 11,500 from 43 labs. We have 5 labs coming up in the Ministry of Health, and I was made to understand there are a few more coming in the private sector and also the university. So at least Ministry of Health, 5 are in progress. So we hope that we can increase the capacity of our PCR lab, RT-PCR. But we also have antibody. If you want to use the antibody, so we say that you cannot use antibody for diagnostic, right? Because if you want to do an antibody and the response is more important is the antibody response. So first day and 7th day, if you want to do antibody response. So if it's negative the first day, doesn't mean there's no virus there. Virus there, probably your body have not generated the antibody. So it takes about 7 days for your IgM to have the antibody in your body. So that's why if the antibody is positive, that means you are exposed. Then we will subject that positive and reactive antibody for a PCR test to confirm whether the virus is there. Now, our gold standard at the best is RT-PCR. And the test kit from Korea, yes, we have done the testing and we are happy with the outcome. But now, I think in the process of procurement. So we have not received it yet, but now we are going through G to G. So we hope that our Wisma Putra will continue to assist us to get the vaccine as soon as possible. Not vaccine, I mean the test kit, rapid test kit, antigen test kit as soon as possible.